Dr. Kristen Reyher is Reyher. Sorry, Kristen.
Sorry, Reyher.
Reyher.
It's difficult.
She's so international, I can't get her name right. So, Kristen graduated from Cornell. She did a PhD at the Atlantic Veterinary College in Prince Edward Island. She's now at the University of Bristol. She's a senior lecturer there. And she leads a consortium in EBVM. She's going to speak a little bit about a global resource today, as well as an interdisciplinary group on antimicrobial resistance. So welcome.
Great, thank you very much. And thanks very much to the earlier talk about how we teach. And so part of this was, I have to admit, a bit selfish to think about how can we teach evidence-based veterinary medicine better in our curriculum and expand it to the global curriculum as well. So just going to start off talking a little bit about, I'm sure everybody in this audience is familiar with evidence-based veterinary medicine, but just the take of the EBVM consortium and others about what is evidence-based veterinary medicine. And really we think it's a balance between what's out there in the scientific evidence, as well as what a clinician has in their own expertise, and the factors from the animal's owner and the animal themselves that are helping us make the best clinical decision for our patients. And in the middle of these three things, we think there's a sweet spot where evidence-based veterinary medicine can really be practiced. Sometimes there's complaints about people saying, well, is it just about what's in the publications and maybe they don't apply to me? I see something different in the animal. And we would say, no, it has to have all of these three arms in order to practice good evidence-based veterinary medicine, just to fend off those questions at the beginning, I suppose. And why do we need evidence-based veterinary medicine? Well, it helps us to make better decisions. So sometimes we've always treated something with the same treatment and it's always worked. And is that just luck, or is that actually evidence? So how do we get around our own bias as humans, thinking that we know best and what we do is right? The evidence and science is supposed to help us to be able to do that. So it helps us to make better decisions, reduce errors when we might get it wrong, and also be very confident about client consent and client communication. And again, I liked Peter's talk about uncertainty, and we certainly would embrace this feeling of uncertainty. And part of the challenge that I'll talk about in evidence-based veterinary medicine is very often there isn't any evidence, so we have an uncertainty. And how do we communicate about that within our colleagues and also with our clients? But that's very important. And ultimately, we hope that evidence-based veterinary medicine leads to improved animal care, which is what we should all be about as veterinarians. But it can be very difficult to do this, and we recognize that in practice, lots of the actions, things we might want to do, are constrained by what the client wants us to do, what we maybe think the client wants us to do, and I would always advocate asking the client what they're thinking, which one of the other speakers talked about as well, and that's great to be able to know. Sometimes there are economic constraints. There's not enough money to pay for this procedure that might be the best thing, or we don't have enough time to really do all the tests and to figure out what's going on with this animal when we need to start some sort of treatment modality. There are resource limitations, so sometimes we don't have access to the tests that we might want to run. There's not availability of the treatments we might want to give. And again, is there this evidence out there to show that what's the best thing that we should be doing? Clinical uncertainties as well about what is this actual animal presenting with and how do we know what that is, as well as the vet skill base. So some of the things that I'm not a specialist, am I really qualified to be able to do this? Should I be doing this? Should I refer the animal? That's going to take a number of days, etc. How do we address that? And we recognize that in farm animal practice, myself as a farm animal practitioner, there are different balances and different things that we have to deal with in farm animal practice that some of our other colleagues deal with, different challenges as well. And so to address this and to kind of think about pushing evidence-based veterinary medicine more into the consciousness of the veterinary profession, myself and a number of people got together, got some funding from the Royal College of Veterinary Surgeons Trust, which is the charitable arm of the Royal College of Veterinary Surgeons, to create an online learning tool called EBVM Learning that was launched last year. So if you've got a tablet or a phone or some other device and you want to log onto the website and have a little truffle around while I'm speaking, more than happy for you to do that and kind of see what I'm talking about in real time. There's the website, www.ebvmlearning.org. And what does it do? It provides open source learning, so we were very keen to be able to use this in our own teaching and also globally to allow veterinarians, veterinary students, anybody that was interested in the topic to be able to log on and learn a bit more about evidence-based veterinary medicine. We also didn't want to reinvent the wheel. We wanted to align with existing resources and not teach epidemiology and statistics all again, so not that you don't have to go to vet school, but here's some information and other links and other places you can go to to learn more about this topic, and also to build a community of practice. So there were a number of academics who were already involved in evidence-based veterinary medicine and pushing that forward. So to get them together and just be able to compare notes and say, what do we think works, what do we think doesn't work, and also to involve the greater global community in learning about this and pushing this forward. So these are this list of names of the people that were in the original consortium. There were members from all of the UK vet schools, as well as North American vet schools and European vet schools. A lot of people that gave a lot of blood, sweat, and tears to this project. And when I kind of said, I think we should do something like this, people said, you want to herd the cats? That could be quite fun. All these epidemiologists arguing about what is a cohort study or a case control study. But it was really fun, and we learned a lot from each other as well. So even that was a great benefit of this project. What the online tool covers then are the 5 steps of evidence-based veterinary medicine, and I'll go into these in more detail, but teaching people how to ask a clinical question, how to then acquire the evidence they might need to answer that clinical question, and how to appraise the quality of that evidence and then see, does it apply to what I'm doing in practice? And if I make a change based on the evidence, how do I assess if I'm doing any better now that I've made that change? Those are the 5 steps of evidence-based veterinary medicine. But before we started down those 5 steps, we had to have a bit of a module to explain what is evidence-based veterinary medicine, why is it important for people that haven't gotten their head around that so much yet, how does it apply to me as a practitioner, as a student, et cetera? What are some of the challenges? The biggest one being there's not a lot of evidence sometimes, and who's out there doing it. So signposting to the people if they want to find out a bit more about who's pushing this forward. Then the first chapter talks about asking a clinical question, why it's important to ask questions. And we try to break down questions into 5 main categories that will help us when we get to the appraise section about what sorts of studies are there that answer these questions that we've set out. We teach learners how to formulate their question in the PICO format. So this is using a population or a patient, thinking about an intervention, something new we might want to do, as opposed to a comparison or comparator treatment maybe. And then what is the outcome that we're interested in? So putting it all into this PICO format and then using that to do some of our searching. And there were people on the consortium from all of the different, representing all of the different species, different specializations, et cetera. So we have lots of examples. They wouldn't let me do just cow examples. Was very sad, but we have lizards and sheep and pigs and all sorts of things to hopefully to engage learners and keep them working through the tool. Then we had a great team of librarians who built the acquire section, talking about where we can find evidence, how do we identify sources of information, and how do we weigh those up against the gray literature versus the peer-reviewed literature, et cetera. And then where do we find that evidence? And we were very aware that this was going to be really marketed to veterinarians in practice that don't have some of the benefits that I do in an academic institution. So if we know you can only get on Google Scholar, this is what you're going to find on Google Scholar. And this is what you're going to miss on Google Scholar, and why you should be using CAB abstracts if you at all can, because it indexes more of the veterinary literature. Things like that, just giving them realistic expectations. And then if people are doing this, teaching them a bit about how to manage their search results, how to reference and report and make these things repeatable, which is what science should be. The appraise section then is when the epidemiologists really had fun, and we talked about why it's necessary to appraise the literature, what factors should be appraised, lots of tools, lots of checklists, lots of links to other places that they could go to learn more about p-values and more about what a case control study is, et cetera. And then we go into apply, and this was one place. So the first 3 steps, there was stuff out there. Evidence-based medicine has gone before us and done a lot of the hard work for us, and there are veterinary studies that can be assessed. But getting to applying, how do we use this in practice? This is something that we didn't find a lot that was already out there written on. So some of this is the new stuff that we've written. Thinking about implementing this, and that can be very challenged. What are people's motivations for or against using evidence-based veterinary medicine? How applicable is this evidence? So there's a study done in beef calves in Texas, useful to me as a practitioner in India on water buffalo. How do I make those sorts of decisions? And then how do we do this within our practice or even personally? Do we just send around an email to everybody saying, this is the new protocol, you will all do this because I've read this paper and I think it's the best way forward? Or do we have journal clubs, clinical rounds, and discuss this with the team and decide what the best way for our practice forward is? And then preparing strategies, again, for change at a personal level and at a practice or clinic level. Then assessing, and this is a big thing in the United Kingdom at the moment, is thinking about clinical audit, keeping track, monitoring, discussing clinical outcomes, trying to do better all the time. And when we've looked around in the team, haven't found very many practice guidelines that are open and accessible to people to find, but encouraging those, as well as just encouraging an ethos of evidence-based veterinary medicine. So having everybody pulling in the same direction and using the evidence. And continually repeating this cycle that once we get an answer and we trial something, we keep some records to see how we're doing better and then ask a question again. We also have some tests. We were told that vets really like to take multiple choice question tests and to find out how much they've learned by working through the tutorial. So this can also be self-documented for continuing education credits. And we also have flexible learning objects that can be taken out of the tool, used in continuing professional development, and lots of us use it when we teach about evidence-based veterinary medicine. So happy for you guys to take those and use them in your own teaching, etc. And lots of problem-based, self-directed learning, asking people to think about when they're going through the tool, think about a problem that you've had recently and how you might approach this in an evidence-based veterinary medicine way, and case-based examples again across the species. As I said, we have lots of links, and so we saw it more as a comprehensive scaffold to be used with signposting rather than a one-stop shop where you'll come and learn everything that you slept through in epidemiology in vet school, for instance, although no one would do that. So we launched this last October at the Evidence-Based Veterinary Medicine Skills Day in London, and so far we've had over 5,000 hits to the site, mostly from the UK, because that's where a lot of us are based, but people in Russia, Brazil, the Netherlands, across Europe, etc. So very happy about that. And we just wanted to say we would like you guys to use and share the resource, please. We made it out and put it out there so it could be used widely. Question and challenge yourself, other practitioners about what's the evidence, why are we making the decisions and thinking about why we do the things we do. Let us know what you think about the tool. And we are also engaging a number of the specialist training schools to talk about, can we put it into certificates, can we put it into internships and residencies, and we're using it at Bristol in that manner at the moment as well. So with that, I'd like to thank you very much for your attention. And I'll take any questions.
Thank you. Any questions for Dr. Kristen?
Oh boy. Yep,
Oh.
John.
What do you think is the impetus to get this style of... Oh,
Thank you.
sorry, John Penry from the United States. Kristen, what do you think is the impetus to get this style of learning approach embedded into veterinary schools around the world? Do you think there's a groundswell for this, or do you think you're literally at the pointy end of the spear?
Well, I think what Peter talked about a little bit as well is balancing up staff time and how much you can do kind of individually versus some of the stuff that at least students can be introduced to. And when we built the tool, each section, if you sat down and read it in depth, should take you about an hour. And when I use it in teaching undergraduates, veterinary students, they worked through one chapter in about 20 minutes because they're very used to using the web. They're very used to surfing and just kind of reading the bits that they find interesting. But then when I gave them an assignment, something that they had to complete, so now think about this clinical scenario and give me a PICO question and then search the literature and find what papers you would report back to your client who asked you, who had this animal. Then they had to go back to the tool and use that, thinking about, they would get to PubMed or whatever, and they would think, how do I do these search terms again? Right, I better go back to the acquire section and think about doing that. So to me, that's a real benefit because they don't have to email me and say, Dr. Reyher, I forgot what I was supposed to use the hashtag for or the pound symbol, et cetera. They can look online and I can point them to that. So I'm quite hopeful that it will be something that can be freestanding and that they can access without having to use staff time in that way. Then my time is better put in doing OSCEs or something like that.
Angus Campbell, University of Melbourne. Could you just go into a bit more detail about how you do use it in your teaching at the moment, please, Kristen?
How we do evidence-based veterinary medicine
Yeah,
teaching?
like how you're using this module, because I suppose listening to it, it sounds like this is a way of educating the wider veterinary community, but how do you use it with your vet student teaching?
It's for both. So we have our evidence-based veterinary medicine teaching starts in the first year, and they look at the ABCs of EBVM and the Ask chapter, and I get them to read it either prior to coming to class or in the class itself. It's a tutorial where myself and somebody else are teaching, so we get them to read it, we circulate to answer questions, then they're given an assignment, they're given a clinical case that they need to think about how do we put this in a PICO question, and and then we get everybody to participate and say, what was your question? What was your question? What do you think about that? What else should it have been? In the second year, we do the acquire section. So then the librarian is team teaching with me. Again, they review the section, and then they come and we give them different clinical scenarios, and they have to form a question and do the search. And then we talk about, okay, if you're my veterinarian and I ask you how many papers did you find, and you found 4, and if this is my veterinarian and they found 40, who am I going to believe? Well, what if I was asking you about my cat and the person with 40 has a paper that is on raccoons? Does that really matter? So kind of thinking about how, then getting into how we appraise. And in the third year, we get them to bring papers that they've read for a previous assignment that they've just turned in, that they would have read, but maybe haven't used a checklist to go through to think, is this really good science? And we have them appraise that. And then the fourth and the fifth year, they do more of the clinical teaching, being in clinics. So then they do more of the applying and assessing and thinking about clinical audit. So we think it needs to start early, and the consortium, again, is trying to think of ways that we can embed it in the curriculum, and how do we make things that need to be in the ever filling up veterinary curriculum.
Thank you very much, Dr. Reyher. Thank
Sure.
you.